चिदानन्दरूप शिवोऽहं शिवोऽहम्।
Good evening, everyone. Please switch on your videos. Vaishali ji, Meghna ji, Suchita ji. Yes, thank you, Meghna Patel ma'am. बाकी के सभी वीडियोस ऑन कीजिए. श्वेता. या थैंक यू शिवचरण सर, वैशाली मैम. Please switch on your videos. Mute yourself and switch on your videos. Okay. So we'll start today's session. Sit straight. We'll start with prayer. Gentle smile on your face. Close your eyes. Make a Jnana Mudra of your fingers. Just press first two fingers and keep it on your thighs. Gentle smile on your face. Observe your breathing. Inhale. Exhale. Inhale with a smile. Exhale with a smile. We will chant 3 times Omkar. Right hand on abdomen, left hand on chest. Inhale for Omkar. Om is made up of 3 letters A, U and M. So तीनों का अलग अलग उच्चारण कीजिए and feel the vibrations. Inhale. Inhale. Feel the vibrations. Rub your hands, keep it on your eyes, and gently open your eyes with a big smile. Good evening, everyone. Chalo, let's start today's session. Let me open chat. Yes. So, let me introduce myself. I'm Dr. Purnima Kale. I'm Ayurvedic physician and practicing yoga and Ayurveda since last 13 years. I have my clinic at Dadar. I'm based in Mumbai, Maharashtra. Okay, and from in my BMS, yeah, we have syllabus of 400 marks yoga in our second year. Okay, so in 2005 or 6, I was in touch with yoga, and professionally I started teaching or giving coachings after COVID. Okay, so I have done Ayush Ministry level 3 yoga teacher and evaluator course, then 500 hours yoga alliance, and I'm pursuing my masters of yoga also. Okay, first year done, and left with second year 2 semesters. Okay, so I want your introduction also, but will not spend time in switch on everyone's video. You can write in your chat box that what is your name. If you are beginner in yoga, then you can write YB. If you have already studied some yoga or practicing or taking classes, you can write it down yoga teacher. Okay, and from where are you? If I am Dr. Purnima Kale, yoga teacher, and from Mumbai, so you can write in chat box, so then we will हम मुझे किसके ऊपर ज्यादा फोकस करना है वो थोड़ा सा समझ में आ जाएगा. ओके, अमृता योगा टीचर नोएडा, ग्रेट. बाकी के लिखिए सभी. शिवचरण सर, आप योगा टीचर हो. बिगनर हो तो भी सभी लिख सकते हैं. इफ यू आर बिगनर. ओके, वैशाली कराळ, पुणे. ओके, ग्रेट. तमिलनाडू, प्रभाकरन सर. ओके. शिवचरण योगा टीचर, जयपुर. ओके, योगा टीचर पटेल. सो सभी योगा टीचर से आई थिंक बिगनर्स कोई नहीं है, राइट? प्रेरणा मुंबई जस्ट कंप्लीटेड 900 आवर्स. ग्रेट ग्रेट. बिगनर फ्रॉम कोलकाता. आईफोन, आपका नाम क्या है? ओके, ठीक है, चलो आप लिखते जाइए. विल स्टार्ट विथ सेशन. ओके, so here today's session is about yoga therapy. Okay, how we can use therapy or therapeutic yoga in case of diseased person to cure themselves. Okay, okay, so this is yoga therapy. Two words are there. First is yoga and second is therapy. Okay, so okay, so we'll move to therapy word. Okay, so if you find therapy word in a dictionary, you will get to know its meaning is to cure person, okay, or to heal person without surgery, without medications or without any interpretation. Okay, कोई भी हम काटा काटी नहीं करते हुए उस पर्सन को ठीक करने वाले हैं, राइट? एंड व्हाट इज योगा, आप बताओगे अभी. बहुत सारे योगा टीचर से थोड़ा इंटरेक्टिव रखते हैं. सो व्हाट इज योगा? योग की डेफिनेशन क्या है, या फिर योग आप क्या समझते हो? योग को आपके हिसाब से योग क्या है?
I think it's aligned to your soul, mind, and body, along with the one things.
यस, राइट. मोर आंसर्स. योग चित्त वृत्ति निरोधः. ओके, it is definition from Patanjali Yoga Sutra, right? So yoga chitta vritti nirodha, या फिर भगवान श्री कृष्ण. yes, भगवान श्री कृष्ण has given in Bhagavad Gita yoga karmasu kaushalam, skills in action, right? Or samatvam yoga uchyate, balance in your equanimity in your life. Okay, so that is yoga. So where it is given that yoga it is used or it has been used for to cure diseases? Is it given in any text that yoga should be used to recover from disease or recover from any illness? Is it given? अगर उनको देना होता तो वो भगवान श्री कृष्ण लिख देते ना कि योगा व्याधि मुक्तः उच्यते, राइट? लिखा है उन्होंने ऐसे, योगश चित्त वृत्ति निरोधः, तो वो ये लिख सकते थे ना पतंजलि ऋषि, योगः व्याधि मुक्तः निरोधः, या फिर योगः व्याधि निरोधः. लिखा है उन्होंने ऐसे, क्यों नहीं लिखा है? आपने सोचा है कभी? और हम फिर व्याधि के बारे में अगर नहीं पढ़ना है, इफ द एम ऑफ योगा इज समाधि, so why we are here to learn this session, or why we are here to we are enrolling in this course? Yes, yes, I'm using English. So why we are here? Yes, Meghna ji, बोलिए. You can unmute. Yes, yes, I am using English. Okay. So if you read Patanjali Yoga Sutra, then in first adhyay they have given the chitta vikshepaha or antarayas, the 9 obstacles in the path of yoga. Okay, what are they? First in that is vyadhi. Okay, see, there are 8 steps of yoga, right? What are they? What are ashtangas? Can anybody tell what are ashtangas? Yama, niyama,
Yama,
asana,
niyama,
pranayam.
asana.
Yes, come on.
यम नियम आसन प्राणायाम प्रत्याहार धारणा ध्यान और समाधि.
Samadhi, right? So the aim of yoga is to reach at samadhi, okay, to reach at enlightenment. But what we are doing in the steps of the enlightenment, that is yama, niyama, asana, pranayam, pratyahar, dharana, dhyan, samadhi, we are facing some obstacles, and the first obstacle in our yogic path journey is vyadhi. So what is vyadhi? Vyadhi is Sanskrit name for disease. Okay, So disease. So if we want to do Trataka, okay, let us take some example. If we want to take do Tratak or meditation, and if I have back pain or lower back pain or sciatica, and if I am not able to sit for longer time, the Vyadhi, the spondylitis or sciatica cannot allow me to sit for longer time and cannot allow me to sit in meditation. Okay, if I have my low hemoglobin level or my low energy, then I cannot deliver what I have energy that I want to give to my clients or any customers or any yoga जिनको सीखना है उनको मैं नहीं सिखा पाऊँ. Okay, if I am conducting class and if I am getting fainting or I'm not able to do any asanas, then I cannot give my 100% to that clients. Okay, so the disease, we will be dealing with disease, and the disease is the first obstacle in our yogic journey or yogic path journey. Okay, so we will be treating that disease with therapy. So we have seen the meaning of therapy to cure or to heal that patient. Okay, then how we will be describing this person is uh, unhealthy and healthy. So as we are dealing with patients, as our clients will be ill patients, diseased person, so we will be categorize them in diseased person and healthy person. Okay, so what is health according to World Health Organization? So health is nothing but, first they have given the definition that just merely absence of disease is called healthy person. Okay, but after some years they revived their definition to, if you are physically, mentally and socially well-being or socially fit, then, and not merely absence of disease, then you can call yourself as healthy. Why this is necessary to differentiate health and unhealth or disease? Because we will be dealing with diseased person. Okay, so what according to you is physically fit? What according to you that you are physically fit? So if your thyroid level is good, your diabetes is good, you have two legs, they are working good, your spine is good, okay, your hands are good, your hemoglobin is good, then you are called yourself as physically healthy person. What if you are mentally healthy? Then if you are able to handle stress, you are not suffering from insomnia, that is sleeplessness, then if you are not suffering from depression, anxiety, okay, then you can call yourself as mentally fit. What is socially fit according to you? What is socially fit? Can you explain what is socially fit? फेसबुक पे ज्यादा सब्सक्राइबर्स होना, सोशल मीडिया पे ज्यादा एक्टिव होना, इज दिस सोशली फिट? No. So socially fit is what we have connections with our friends, with our family, at our offices, community. So we should have harmony in that with that person, and we should interact with every person in another way. Okay, हमारा सबके साथ अच्छे से जम रहा है तो हम socially fit है. Okay, so if you are physically, mentally and socially fit, then you can call yourself as a healthy person. Okay, what Ayurveda has given before 10,000 years ago, see, same definition was given by Ayurveda: samadoshaha, samagnisha, samadhatu, malakriya, prasanna atmendriya manaha, swasthya ityabhidhiyate. Okay, so it is Sanskrit, little bit difficult, but you'll get to know every word. Swasthya ityabhidhiyate. समझ में आ गया? स्वास्थ्य is Sanskrit name for health. So health इति अभियते किसे कहेंगे? Health is called. किसे किसे कहेंगे? First they have given criteria. Samadoshaha. So in Ayurveda we have 3 doshas. Okay, Vata, Pitta, Kapha. If you have balance in that three dosha, you can call yourself as healthy. If you have your digestive fire good, because Ayurveda has given immense importance to digestive fire. If your digestive fire is low, you are more prone to get many diseases. Okay. So digestive fire, if you have good digestive fire, then you are healthy. Then there are 7 dhatus in our body. Okay. What are dhatus? These are 7 structures from which our body is made up, like plasma, like blood, like muscles, fat, bone marrow, semen. Okay. So these are 7 different structures from which our body is made up of. If they are in equal quantity or they are in good quantity, then we can call ourselves our dhatus are in good condition. So we can call ourselves are healthy. Okay. Samadhatu, samadoshaha, samagnisha, samadhatu, mala. So what are malas? Malas are nothing but excretory products which we throw from our body. That is, first is our fecal matter, our urine, and our sweat. Okay, so these are excretory matter. If you have noticed one thing, if we don't pass our bowel daily or our bowel movements are disturbed, or if we face constipation, then we are more prone for acidity, we are more prone for bloating, and many more diseases can come to us due to that only constipation, one symptom, okay, or one disease. So that is why excretion of waste product is very much needed, and that is given value in the health. Okay, so samadosha, sama agni, agni means digestive fire, samadhatu, that these are 7 structures, sama mala or mala. Last three, see what they have given 5 to 10,000 years ago. Prasanna, yani blissful, happy condition of what? Prasanna, Atma, Indriya, and Manaha. See, now we are hum rote hai, we cry that stress is more, and nowadays stress has increased, and nowadays psychosomatic diseases are getting increased. But if they have written that 3 words, Prasanna, Atma, Indriya, and Mana, in the definition of health, so at that time also there might be these patients or of psychosomatic diseases or psychological problems were more in that era also. Okay. So what are 3 conditions? Prasanna means happy. What 3 should be happy? Atma, Indriya, and Manaha. Mana is mind, Atma is soul, and Indriya are again Pancha Jnanendriya and Pancha Karmendriya. Okay. What are Pancha Jnanendriya? What are 5 sensory organs? वीडियोस ऑन कीजिए बाकी के, बी प्रभा सर, प्रेरणा मैम, मारुति प्रसाद सर, प्रतिमा जी.
eye, mouth,
हाँ, yes,
eye, mouth, skin,
yes. Is mouth included in 5 sensory organs? Anyone? This is not your taste. Actually, you can unmute and speak. We are just interacting. No.
Pardon, ma'am, what did you ask?
What are 5 sensory organs or sense organs?
Ears, nose, eyes, tongue, and skin.
Skin, right. So mouth is not a sensory organ, but tongue is sensory organ, because mouth does not play role in providing senses as tongue provides. Okay. So these are 5 sensory organs and 5 karmendriyas. Pata hai karmendriyas?
Yes, hand, leg,
Hastau, padau, vak, pani, upastha. Okay. Genital organs, urinary organs, and speech. Okay. So these are 5 karmendriyas. So these all should be healthy in according to Ayurveda. Okay. So according to Ayurveda, according to modern science, the health is defined as what we have seen it. Okay. Why this is necessary? Some people come to you for yogic therapy. They'll not come to you as taking one disease or I have this problem and solve it. Okay. You need to take detailed case history of them, that you need to ask them what is your, how is your bowel movement? How is your urine? How's your appetite? How's your sleep pattern? Okay. So by examining all these pattern, you will get to know that this person is suffering from this disease. The dosha, vata, pitta, kapha is increased in this patient, and we will plan the yogic therapy. Okay. So moving ahead, in yogic therapy, we will be giving them. So we will be categorizing these patients in 3 levels. Okay. First, second, and third. In first cases, if diseases are of hormonal imbalance or stress related problems, or we can say lifestyle disorders, we can treat them purely with yogic therapy. Okay, purely with yogic therapy. Like for example, if you have PCOS patient, if you have thyroid patient, if you have depression patient, you can claim them that yes, I will be treating you with yogic therapy for at least give me at least 3 to 6 months. Okay. Second category, we will uh, treat these patients in parallel therapy. Okay, what will be the parallel therapy? That if they have already started their allopathic medicine, for example, take diabetes patient. Okay, if diabetes patient is already taking that medicine, already taking insulin, then we will not stop abruptly their medicine. We will be giving them yogic therapy with their allopathic medicine. We will repeat after 3 months, we will repeat their investigations, that is HbA1c, the 3 month sugar level. If that is giving a good result, we will send this patient to their physician. They will reduce the dose of diabetes. They will reduce the diabetic tablet. They will reduce the dose of insulin. Again, same yogic therapy, same medicine will be continued again after 3 months, again investigations, and with that investigations, we can reduce the dose of tablet, or in some cases we can stop the tablet also. Okay. So if in diabetes, actually physicians will not stop that tablet, but they will give minimal dose of that tablet, but that is also okay, because the allopathy medicines, who is unmuted? Because the allopathy medicines have many side effects. So at least we are minimizing their side effects to their body. So we are improving their lifespan also. Okay. So this is second category. And third category, that is like we will not touch that patient. So that will be like heart attack hai, accident hai, stroke hai, emergency management. In that emergency management, the golden hour of 1 hour, 1.5 hours in every disease, it is necessary that the patient should reach to that ICU hospital and should be admitted and should be given the emergency management. Okay. So किसी को हार्ट अटैक आया है, शॉक लगा है, बर्न हुआ है, एक्सीडेंट हुआ है, so will not, हम उनको नहीं बोलेंगे अभी बैठो, ये आसन करो, ये प्राणायाम करो, नहीं. Okay. So there are some limitations, there are some benefits to every pathy. Okay. Modern science के कुछ modern science have some benefits, that they are best in acute management, but they have some side effects, that they are not good in chronic management, like hypertension. They don't manage, they don't cure it, they just manage it with tablet. Lifetime tablet लेनी पड़ती है. Thyroid, lifetime tablet लेनी पड़ती है. इस प्रकार, in this way, they are good at acute management, but they are not good in chronic management. Okay. In Ayurveda, it is vice versa. We are good in chronic management, like joint disease, skin disease की जहाँ पे वो लोग steroids ही दे रहे, वहाँ पे we can give excellent result with Ayurveda therapy. And we have, if I have that patient of heart attack, obviously I will send it to hospital and they will manage it. Okay. So I know my limitations of Ayurveda also. Same like we don't have to hold that ego. नहीं मैं ही करूँगा, मैं ही करूँगी, नहीं. It is related to patient. We will be dealing with patient, and it is related to someone's health. So if we should not hold that ego, and we should send them to hospital in third case, that is in emergency management. But in first case, in first criteria and second criteria, we can manage very well. And now being yoga teacher, being Ayurveda doctor, I will assure you that there are many cases increasing in lifestyle disorders like diabetes, thyroid, PCOD, hypertension, depression. So you will get good number of clients. So no need to go to an emergency management and all. Okay. So these are criteria. What are benefits of yogic therapy? That कुछ काटा काटी सर्जरी नहीं है. We will not advise them any surgery. Will not doing any giving them any medicine. So it is cost friendly. Just patient need to give 1 hour. Instrument ज्यादा नहीं लगते, सिर्फ yoga mat, props, some props will need. That's it. Okay, so these are benefits they can do from their home, or your say they can come to your yoga studio and they can manage their disease. Okay, but in case of hospital, they need to admit at their hospital. If they are advised to if they are advised for surgery, then the stay of surgery is like 2 to 3 lakhs, and same patient we can treat in 5 to 6 thousand, or at least a maximum 10,000. Okay, so it is yogic therapy is definitely cost friendly. If you give good result to one patient, the one patient will send you 10 similar patients. Okay, ma'am, this class 85 नहीं समझ में आया. I don't understand that what you are written. Classified course class. क्या बोलना चाहते हो? iPhone. You can unmute and ask your query. Okay, so what we will be doing? We will be doing in this course, it will be 24 session course. Okay, we will be covering 15 to 18 diseases, minimum 15 as time permits, maximum 18 diseases. Okay, you'll get some PDFs of reference books of that yogic therapy. Then you will get regular recordings of every session after your class, at least after 2 to 3 hours, because it needs some time for that upload and all in YouTube. After some time, 2 to 3 hours, you will get recording of your session. You can go through that recording, and if you have any query, you can ping me and voice message on WhatsApp group. I will answer your queries. Okay, you will be getting daily. अगर हमने sciatica, if we have covered sciatica, I will be giving you sciatica detailed yogic therapy. Okay, so it is written. It is in written form. I have written it in message form, but I don't have PDF of that. Okay, so you can make PDF of that. I have PDF of reference books. Okay, so I will be providing that after every session. If I have completed sciatica, I will be giving you sciatica notes. That is what asan, what pranayam, what bandha, what mudra, what stretching, what type of ahara, what type of vihara you will be doing in particular disease. Like this, we will be covering 15 to 18 diseases. Okay. Then you will be getting International Yoga Alliance certification. You will get soft and hard copy both after completion of 24 sessions. And that's it. If you have any query, then you can ask now. Otherwise, we'll start with some first disease, that is, we'll see anatomy of our spinal cord. Okay. If you have any query, you can ask regarding course. Is it clear? Till now, it is clear.
Yes, right, ma'am.
Okay, so no queries. चलो ठीक है, तो हम स्पाइनल कॉर्ड की थोड़ी एनाटॉमी देखते हैं. सो कल हम स्पाइनल साइटिका डिजीज करेंगे, उसकी ये एनाटॉमी. 1 सेकेंड. Yes, class timing will be 8 to 9. This is actually English batch, but if anyone wants Hindi, I can share you Hindi notes and Hindi recordings after completion of session. Okay, Hindi recording playlist जो होती है, वो मैं आपको after 24 session के complete होने के बाद भेज सकती हूँ. So if you have any problem regarding time, you can watch recordings, and if you have any problem regarding a language, again you will be getting recordings of vice versa, another language also. Okay, any query,
So
Ajay sir?
we need to write anything. Everything is done in through the notes. We need to write down anything.
If I'm explaining you sciatica, so I will be providing you from yogic therapy, from asanas, that to how you will cover that. But if you want symptoms, if you want causes, you can write it down in your notes. Okay, it is given in reference book, but it is not like book जैसे नहीं है. मतलब it is actually professional course, right? So word to word you will not get in book. Poor video. My video quality is good. Maruti Prasad sir,
Maybe their side the would be a network weak.
you can unmute.
Only audio is visible, madam.
No,
Audio-
everyone is able to see me, hear me clearly. I
Yes, we are
think
seeing, but video is not.
no, I
Okay,
think
madam. No,
there will be internet
no.
issue from your side.
Okay, madam. Okay, no problem. Now it is
Please
clear.
check it, and you'll get recorded video also. So you can
Okay.
go through recorded video after class, okay? And you can let us know that what is your query regarding course. Okay, done with course details. So this is our vertebral column. Okay. So this is our vertebral column. It starts with hip and it ends. It starts at our neck and it ends at our hip region. Okay. What is function of this vertebral column? The first function is to support head to our hip region. Okay, what is function? It supports head to our hip region. What is second function? It helps us to bend forward, to bend backward. Okay, so it helps us to give mobility. Okay, so this is, if you are able to see this part, this one bigger one, so this is called vertebra. Okay, vertebra. So these are 1, 2, 3 like this. These are 33 vertebrae are there. Okay, so plural form we will call it as vertebrae. Okay, so this is 1 vertebra, 2, 3, 4, 5, 6 like this. These are 33 vertebrae. Okay, are you able to see clearly? Okay, so between two vertebrae we have this milky white structure. See, I am pressing it. So it is just going in and out. Okay. So these are intervertebral discs. Yes, right. Right, Marcus. So these are intervertebral discs. Okay. Inter means between two vertebrae. These are discs. So what are main functions of these discs? These discs act as shock absorbent. Okay. When we stand up, when we sit, when we jump, when we do yogasana, then there we put some pressure on this vertebra, and this pressure, this stress is absorbed with this intervertebral disc. Okay, so what is function of disc? Shock absorbent. Okay, if these discs are not there, what will happen? That these two vertebrae get closer to each other, and due to that closure, these nerves will get pinched in that vertebrae, both vertebrae, and that will again cause further symptoms. Okay, we will be seeing symptoms also. So you are you able to see these yellow wire-like structures?
Yes, yes.
Okay, so these are nothing but nerves. Okay, nerves, nerves. So what are nerves? See, there are three types of vessels in our body. One is artery, which carries pure blood. One is vein, which carries deoxygenated blood. And one is this nerve, which carries signals, okay, from brain and from spinal cord. See, if I'm making chapati or roti, and if I put my hand on tawa or a hot plate, then I'll remove my hand instantly. How it is possible? The brain sends signal to my hand, Purnima, हाथ को निकालो, remove your hand, otherwise it will get burned through these nerves. Okay, मुझे signal कैसे मिलता है? So through these nerves. Okay, किसी के बारे में क्या बोलना है? What to talk, how to think, when to sleep. It's all signals are sent by these nerves. Okay, from brain and from spinal cord. So brain, spinal cord, and these nerves together make nervous systems. Okay, nervous system. So these are part of nervous system. See, so there are 33. So we'll revise their names. First, you will see this one. First is cervical vertebrae. Okay, cervical vertebrae are 7 in number. Okay, C1. Names are not given. First two names are there. Atlas axis. After that, C3, C4, C5, C6, C7. Okay. So C7. If you have any patient or any client of neck pain, then if you have read any MRI, then it is clearly written that there is gap in between C3, C4, or bulge in between C3, C4, or C5, C6, or C6, C7. Okay, so C, it is represented as cervical. Okay, so you can write down C is equal to 7 is equal to cervical vertebrae. Okay, so C7 are cervical vertebrae which supports our neck. Okay, these are neck vertebrae. You can call it as neck vertebrae. These are here, not in front, but at back side. If you keep your 3 fingers at your back, and if you just press it slightly, you can feel cervical vertebrae easily. Okay, you can try it. Just press 3 fingers below, behind your neck. Okay. After that, these are C7. Then thoracic are 12. So you can write T is equal to thoracic is equal to 12 in number. Okay. So what are the functions of thoracic nerve, thoracic vertebrae? So it supports our chest. Okay. These thoracic vertebrae are connected to ribs. Okay. What are ribs? पसलियां पता है ना आपको, जिसके अंदर हमारा lungs होते हैं. So these are supported by these ribs, and lungs and heart is getting protected with that ribs. Okay, so these are nothing but thoracic vertebrae. Okay, then last 5 are lumbar vertebrae, or some may pronounce it lumbar vertebrae. Lumbar. Okay, lumbar or lumbar, anything. So this is L5, L4, L3, L2, and L1. These are biggest vertebrae. Okay, these are biggest vertebrae. L1, L2, lumbar 1, lumbar 2, lumbar 3, lumbar 4, lumbar 5. So these are, if you have seen any patients of sciatica, if you have seen any patients of spondylitis, lumbar spondylitis, then in their X-ray or in their MRI, it is clearly written that this bulge between L3, L4, L2, L1, okay, L4, L5. So this is the investigations written in MRI. Okay. Then after that, this triangular this one, okay, this is actually 5 bones. When we are fetus, or when we are young, these are actually 5 bones. Okay, these get fused after some time, after some years, and it is getting fused in one bone that is called sacrum. Okay, this one. These are 5 bones. Okay, 5 vertebrae fused to form one bone. Okay, and this is last again tailbone. Okay, this one. These are again 4 vertebrae fused or unite together to form one vertebra. Okay, 4 to form one vertebra, that is called coccyx. Okay, so this is tailbone. If you might have seen some patient having tailbone pain, or you might have felt sometimes that tailbone is paining. So this is nothing but this vertebra is getting pain. Okay, so this is total 33 vertebrae, and we will be discussing sciatica tomorrow at the same time. The disease, first disease we'll cover, which will need L5, L4, L3, L2. Okay, so this is, you can say this red one is sciatic nerve. Okay, so these are sciatic nerve starts from L4, L5 and S1. Okay, this travels from your hip region, this travels from your hip region, then your knee joint, then your calf muscles till your foot region. Okay, I will be showing you tomorrow images and all, so it will be clear to you. But this is regarding lumbar vertebra, and we'll be starting tomorrow that disease. Okay, any query in this model? Should I repeat anything?
Total is a 33, right?
3, huh?
So after the fusion, this is 33. Yeah, when we born, it's a 33, and the
Yes.
fusion.
Yeah, after fusion, it is not 33. We count that as 5, and we count
Right.
coccyx as 4. So 5,
Oh.
4. Okay. Any query? आ गए सबको समझ में? Okay.
So ma'am, we can able to, the guide, yeah, after these course, is it we are able to do therapy to clients? Is there is specific?
Yes, yes, yes. You will treat the clients very effectively. In our last session, now it is my, I think, 9th or 10th batch, but people are doing excellent. They are sharing reports with me. I will guide them, or I am guiding them, and they are doing very good in yogic therapy. एक पेशेंट, एक क्लाइंट जो थे, उन्होंने तो क्लास शुरू होते ही clients लेना start किया, and she got good results in diabetes and hypertension. I have screenshots of that. I'll share it.
So these
So
certificate
you will
is
able to cure that patient, or at least reduce their dose, or at least reduce their symptoms. Okay, with yogic therapy. Any query? Indra Thakur ma'am. You're mute.
Excuse me, ma'am.
Yes.
This certificate we can register in employment office.
Register in?
Employment shall
This
be.
is actually International Yoga Alliance certification based of USA. So I don't know about registration of employment in your state, but it is authorized from USA, and it is used by yoga teacher. Actually 500 hours 200 hours जो हम करते हैं वो इंटरनेशनल योगा अलायंस का ही granted होता है. So I don't know about what you are talking about, that a registration.
All
You
the
can
course
ask about, you can ask this to Rajiv sir. Okay, difference
Raju sir.
between spondylitis. Yes, yes, we'll explain it tomorrow. We'll starting tomorrow session, tomorrow disease, so I'll explain that.
so
Okay,
we
this
will
is
learn.
yoga therapy. The course name is yoga therapy. Any
Certificate,
other short form having, or only yoga therapy?
certificate course in yoga therapy. affiliated by International Yoga Alliance. This is the name. Certificate course in yoga therapy. You can simplify it.
Okay, we can add in our name.
Yes, you can add that certified yoga therapist. You can write certified yoga therapist in your degree. No, yes.
Yeah.
You'll get
Okay.
certificate of that.
Okay.
Ma'am, so is it we also able to learn technically how to, all the things in X-ray? We suppose if any patients came to us and, show the other X-ray, so we are able to find out the particular nurse and the problem.
No. The diagnosis part is not of a part of yoga teachers. Actually, it is a part of doctors. So you will get diagnosis done by a doctor or patient. They'll come to you with reports or symptom. I will explain you the symptoms. If you are able to diagnose it with their symptoms, then you can start with yogic therapy. But in some cases, we need help of doctors. So I am here. If you have any your family doctor, you can send them reports. If thyroid reports are there, there is different yogic therapy in hypo and hyper. If you are confused, that you can send me reports. I'll guide you that give them hyperthyroidism yogic therapy that we have learned in our course. Then you can treat with that. Okay. But X-ray reading, MRI reading, or any other diagnostic reading will be not covering it.
I think in all cases, not a compulsory key. We just done first the
Yes.
X-ray, right?
Yes.
First, I think suppose the people are suffering with the backache or something, lower back pain, so we can guide us before also, right?
Definitely. And
Right, right.
if they get good results, they'll not need of doing that X-ray and MRI and that spending money in CT scan. Okay. How much is course fee? Course fee actually you need to ask to Rajiv sir. So are you in group? Are you in group of our Shubha Yoga group? Do you have Rajiv sir's number? Yes. So you can message them, Rajiv sir or Sachitananda sir. They'll inform you about exact amount of yogic therapy fees. Okay.
And this is only theory class only, or any practical you will show?
No, practical will be done. Every disease, every asana, every pranayam will be demonstrated. But it is not like कि बाकी के yoga therapy के बाकी के yoga sessions के जैसे classes होते हैं that you will get exhausted, you will get cure of your disease. No, this is not like that. We will be doing some asanas, some pranayamas that are new. And after that, if I taught you Kapal Bhati at the very first lecture, I will be not repeating it at the 15th lecture or 14th lecture. Okay. So if I have demonstrated you one asana, so in next disease, if same asanas come, then I will tell you that this is the Pavan Muktasana we have done in constipation. Okay. So practical will be there, but not like yoga sessions. Okay. Practical of asanas or pranayamas, mudras and bandhas are we will be doing that.
Okay.
But not like flow and मतलब पूरा एक क्लास आप इसका होगा प्रैक्टिकल का वैसे नहीं होगा. So
Okay,
more
okay.
over theory and जो नए हैं if anyone is beginner then I'll take their asanas practice also.
Okay.
I have some questions.
हाँ yes अजय sir बोलिए.
Actually, I am a beginner and I'm not means, doing some yogas and all these things. I am just expecting that in this session you are going to teach us me some yoga. So, is it okay for me to go for this course or something like?
Actually, it is necessary to do at least 200 hours teacher training course that at least you should know some asanas or some basics of asanas and pranayam. So it will be better for you. But if you want to do, I can demonstrate every asana and I can take practice with you. But it will be little bit difficult for you. Okay.
Yeah, definitely. My another one question I would like to, is there any courses from your side that showing me for learning the yoga?
There
Like you
are
told me
courses
that
of
I have to go for 200 hours of yoga training, so like that. So is there any courses from your side only?
From my side, actually it is from Shubha Yoga Academy, but I am not taking
Yes.
that batches. Yes, their teachers are different.
Okay, okay.
I'm
So I
taking
have to
this
go.
yoga therapy batch, Hindi and English batches. And I have my own clinic. I have my own batches also. So I don't able to give that much time to conduct another batches or another courses. Okay.
Okay.
Mixed
Thank you.
language. Yes, yes, ले सकते हैं.
Yeah, I think he can check with the Rajiv sir. The many courses are running currently is also.
Yes, yes.
Okay, okay. Thank you.
Chalo then, anyone have any query? So I think 14 people are there. Some people will see recording, go through recording, and they'll join us tomorrow, hopefully. So hopefully we'll join 20% tomorrow, right? दीप्ति अग्रवाल जी वीडियो ऑन कीजिए.
जैसा आपने बताया आहार विहार वगैरह everything is covered in therapy. So this is also covered by one, right? What the other things we can add, right? By the diet या कोई थेरेपी के लिए सपोज अ पर्सन इज सफरिंग फ्रॉम द लोअर बैक इशू या किसी को नर्व्स का है सो हम उसके
Yes.
डाइट वगैरह का भी लर्न करेंगे राइट
yes yes
ओके
disease wise diet होगा. disease wise आयुर्वेदिक आपको recommendation भी दिए जाएंगे कि if you have knee pain and it is related to arthritis, so you can use this oil for massage. You can use this if arthritis is definitely related with calcium loss, so I'll advise I will give you the calcium rich food that can be introduced in that patient. So we'll cover all this with one disease with all aspects, so that patient will get more benefit and you will get more patients. Okay.
right and would be interested also for the what we guide and take some session for the young children who are basically on the laptop every time they have a bad postures and so
Okay.
please guide us to few
Yes, yes,
postures as
definitely.
to
Posture correction, actually, it is included in many diseases like back pain, knee pain.
right.
So I'll guide you about posture, no problem.
Thank you so much. It's a lovely session.
Yeah, thank you. So can we end?
Yes, we can.
Sure. Sit straight. We'll end with Shanti mantra. Sit straight. Smile on your face. Inhale. Exhale. एक बार स्माइलिंग फेस के साथ श्वास लेके देखिए, यू विल फील डिफरेंस. और बड़ी स्माइल. इनहेल. you'll feel relaxed. Exhale. और बड़ी स्माइल. इनहेल and exhale. Namaskar mudra of your hands, palm to heart center. Inhale for Shanti mantra. Om Purnamada Purnamidam Purnat Purnasamuchate Purnasya Purnamadaya Purnamevavashishyate. Om Shanti Shanti Shanti. Rub your hands. Keep it on your eyes. Gently open your eyes with a bigger smile. Thank you everyone for joining today. Bye-bye. Take care. See you tomorrow. Good night. We'll send recording after some 1 hour. And you can share it with your yoga friends. If you have any, if you are doing any other yoga courses, you can send with your colleagues. Yeah. Thank you. Thank you. Bye-bye.
Thank
Take
you,
care.
ma'am. Thank you.
See you tomorrow.